guys. We are officially starting this jam. My name is Laura Evans. I am the AVP of Public Policy with Vibrant Emotional Health. And today on episode 173, we're going to be talking about CROP. We'll hear about that acronym later. Outreach to communities of color and marginalized people. We have Katie Storr from Mississippi Department of Health, along with Sylvia Turner, who will be with Mississippi Public Health Institute, who will be giving us a featured presentation. But before we get into their featured presentation, it's going to be really great, looking forward to it, want to do a little bit more about the Crisis Jam. Remember to go to talk.crisisnow.com, where you can find more information about this learning community. You can register because that is required for you to join now. Share that link with your colleagues so that they can join on their unique link. You can sign up for the newsletter. You can grab some virtual backgrounds. You can see the previous jams, right? You can watch it in its entirety on YouTube. We have the various segments broken out here. So if there's something that you're looking for in particular, a certain topic, or maybe what was the last hot seat question, you can find all of that and more on talk.crisisnow.com. So make sure you check that out, bookmark it. And again, so moving forward here, we have had over 400 unique speakers since 2020. Again, this little crisis jam has started from 20 to 30 people to now over 300, 400 joining us live and of course watching on YouTube. So if you would like to be a speaker, if you have an idea, please let's add your name to this list. Share your topic with us. We want to make sure that we are hearing from everyone. And again, this is such a vast undertaking to reform and reimagine our crisis continuum. We want to hear what your thoughts are on that. So just starting with some news here, wanted to make sure everyone has seen a news article that came out around LA County. They had recently received a grant, I believe it was $2.5 million for their mobile crisis. And they're using this to help do follow-up and ensure that individuals who have made contact either with the crisis call center or mobile team, how we're following and tracking those outcomes. So really good article. Make sure you take a look at it. And then also flagging for you all, we are now, I think, in the beginning of conference season. I know some folks are at APA and just got back from the convening. Tomorrow, there is a Shaping Tomorrow, a dialogue series on the future of mental health and suicide prevention with Dr. David Rudd. Make sure that you register for that. That information is in the chat. Serving our communities, how people with lived experience make mental health crisis services more effective. A+, this is like amazing. This is very true. From the Bazelon Center and SAMHSA. Another great webinar to check out. The link will be in the chat. Great speakers there. Save the date, lots of things happening. State peer-to-peer learning sessions. This is a SAMHSA State Improvement TA event on May 15th from 3 to 4:30. Mississippi, New York, and Washington are going to be presenting. The 15th is also a very busy day, just to make a plug for some of the work that Vibrant and Vibrant and AFSP, American Foundation for Suicide Prevention, and NAMI, EDC, Action Alliance, Huntsman Family Foundation. We're going to be having a congressional reception and celebration of Mental Health Awareness Month and the national strategy release. So lots of good things happening for Mental Health Awareness Month. So information on this program's in the chat. Looking further out, but a great conference nonetheless. Crisis Con 24 will be October 14th through the 17th in Phoenix. The call for presentations is still open. I went to this conference last year, and maybe the year before that. Just amazing, great opportunity to hear from folks who are on the front line. So make sure you check that out and submit your proposal idea. All right, so with that, today I am pleased to announce that everyone is on the hot seat. So this is one, again, where we're asking you, right, Times Person of the Year, everyone to participate on this hot seat question. So in June 2005, over 100 people convened for the National Conference for Survivors of Suicide Attempts, Healthcare Professionals, Clergy, and Laity. This pivotal event marked a significant milestone by embracing attempt survivors with a seat at the table. Again, lived experience, so important. The annual National Suicide and Black Church Conference is hosted in the same city. What is the city? We have A, Atlanta, B, Memphis, C, Nashville, D, New Orleans. So what is the city that hosts the annual Suicide and Black Church Conference? If anyone wants to raise their hand, we can let folks come on video and off mute to walk us through, or of course, put your thoughts in the chat. But really, you all are on the hot seat today, and I want to see how you do. Full disclosure, I did not get this correct. All right, any takers? Anyone wants to walk us through their thought process? Okay, well, let's see here. We've got the audience. Again, all of you on the hot seat, 58% of you are thinking Atlanta. We've got 29% with Memphis, 2% Nashville, and 10% New Orleans, or Nolans, I guess, if I was from there, that's how I'd say it. Well, unfortunately, audience, today we are incorrect. The correct answer is B, Memphis. So those 29% of you, give you guys a big round of applause, clap on the back. Attempt survivors reported often feeling unwelcomed, or that their perspective was considered less than valid than those bereaved. The Breakthrough Conference provided a forum to express their views and gain strength and support from each other. So Memphis, again, another important city when we talk about the Black church. And of course, you know, we want to make sure that folks who are attempt survivors, loss survivors, everyone feels welcome. And so just such a pivotal conference for that. So great try. We wish that we could give everyone a shirt or hat for being on the hot seat. Unfortunately, I don't think we'll be able to do that. But thank you all for playing. And if you do want to get that shirt, get that hat, please reach out and let us know that if you want to be on the hot seat. These questions, you know, you can get a call a friend, you can use the audience, which is usually right. We were off this time, but you know, if you're interested, please let us know. We want to make sure that we hear from you. All right, so let's move on from the hot seat. And we are going to be going into our featured presentation. Again, I want to welcome Katie Storr, who's the Chief of Staff for the Mississippi Department of Mental Health, and Sylvia Turner, who's the Program Manager at the Mississippi Public Health Institute, to share and talk to us about outreach to communities of color and marginalized people. With that, let me turn it over to you, Katie.
All right. Hello from Mississippi, and happy Mental Health Awareness Month. Excited to hear all the great things that are happening throughout the month. So the Congregational Recovery Outreach Program, or CROP, like we like to call it here, its basic premise is to reach communities of color, to provide substance use and mental health resources and training and support to faith-based communities, and to empower those faith leaders to provide an atmosphere that's open and welcome and knowledgeable for people who are going to seek help at their church as a first point. In Mississippi, and I know in many states that may be here as well, especially along the Southeast, faith plays a huge role in our culture among many races here. It is not uncommon to drive through a town in our state and there may not be a working traffic light. There may not even be a fully functioning grocery store, and the residents there will have to drive over an hour to get to a hospital if ever needed. But you're going to find 3 to 4 churches, probably all beside each other in that same town. The churches in our state are a hub of community and activity and activism. And this is the same for rural and even our larger metropolitan areas. Church is a huge hub where people come together. And oftentimes the only place where people want to go to seek help. So CROP is an excellent opportunity to reach communities of color, to be able to talk about substance use and mental health and connect people to help when that happens. It's a community-based, it's a grant-funded program, and it's in partnership between the Mississippi Department of Mental Health and our Mississippi Public Health Institute. And the mission is to foster those faith-based communities with aims to reduce racialized behavioral health disparities. We have piloted the program in Hinds County, which is one of our largest counties. It houses our capital city of Jackson, and found it to be very effective here. We have a brief video where you can hear from some of our partner churches and people who participated in the CROP program, and also talking about how important 988 is to this and to a state like Mississippi.
In the heart of Mississippi, where faith and community intertwine, we are proud to have a homegrown program that brings hope and healing to our congregations. Welcome to the Congregational Recovery Outreach Program, or CROP. Wendy Bailey, the Executive Director of the Mississippi Department of Mental Health, and Pastors Ronnie Crudup from New Horizon Church and Jennifer Beard from Jackson Revival Center understand the importance and value of this initiative.
At its core, CROP is about hope, healing, and access to help when we need it most.
Our congregations are not just places of worship, they are centers of community support.
Our vision is to cultivate a faith-based community where love and support can be felt the most, especially when caring is simply not enough.
Our faith-based institutions are trusted pillars within our community. We can help break the stigma surrounding mental health challenges and bring the vulnerable and desperate a true lifeline.
Training congregations on how to recognize warning signs and risk factors and help connect people with substance use and mental health treatment are the top priorities. This past year, 94% of all congregational members trained through CROP said they gained valuable knowledge about mental health, emotional well-being, and substance use from the trainings. We are bringing national and Mississippi-based 988 messaging into our trainings, events, and outreach, not just in a few churches, but across the entire state. One crucial aspect of CROP is to access 988, a behavioral health crisis line connecting people to trained counselors in Mississippi 24 hours a day, 7 days a week. Having this resource at your fingertips is an extra tool in your toolbox, always ready to support your congregation and you in times of crisis.
We know that a church is more than just a place of spiritual guidance. The church can serve as a sanctuary for those seeking help with addiction or mental health crisis.
A compassionate community where they can openly share their burdens and receive the tools and understanding that they seek.
If you or a loved one is experiencing a crisis,
No matter if it's day or night,
reach out to 988 or visit 988lifeline.org.
Together, we can make a difference, save lives, and build a stronger, more compassionate Mississippi.
Let's spread the message of love, understanding, and support throughout our great state.
So we also have Sylvia Turner with us today, and she manages the CROP program, and here to share some of her insights on how it's impacted our state.
Good morning, and thank you very much for having us. I bring you greetings from Mississippi Public Health Institute, our CEO, Mr. Roy Hart, and our Chief Administrative Officer, Glenda Crump. We are happy to be with you. As Katie, thank you so much for the introduction. And I thank Katie and Wendy, the Executive Director for the Department of Mental Health, for allowing us to pilot this project and seeing exactly what is needed. From our pilot, and we're in our last year of the pilot year, we have 3 churches that joined us, Jackson Revival Center, Pearl Street AME, and New Horizon Church. We implemented the program in these churches first because they had their components in place to actually get started with the proven model that we're modeling from the state of Tennessee, the Tennessee Recovery Model. And with that, we're able to implement this program, which it focuses on training the leadership team first. So the pastor, his pastoral staff, and all ministry leaders were trained with a 12-week training session. And some of the topics that we trained on were person first language, mental health first aid, drug trends, and understanding the resources that are available to churches to help reduce the stigma and the negativity that is associated with people seeking help for mental health and substance use disorders. And we also trained on a particular component, which was real colors, which was like a personality assessment, so that they can learn how to get along and know who is laboring with them in order for them to be more effective in their outreach. We also recently added a training component called Triumph Over Trauma, which is a 7-week session to help trauma care recovery and give trauma-informed care tips on how to help people manage their trauma. And fortunately for us, through our trainings, some of the churches have elected to have their CROP liaisons and coordinator become certified facilitators in mental health first aid, real colors, and Triumph Over Trauma. Just recently, the state of Mississippi did our first Mississippi Mental Health Faith-Based Summit, which was held Thursday, April the 25th at the Jackson Convention Center. And we invited churches across the state of Mississippi to join in and come and have a dialogue and a conversation about how faith and mental health connect. As stated earlier by Katie, is that many people, when they want help, they see the church as the first place of contact. In the African American community, we are not as receptive to seeking help. So through CROP, we've been able to go out in the community, be visible in many health fairs and activities that various organizations have. And so what we wanted to do was to bring people together. And from that, you're seeing the evaluation brief. We had over 200 people. There were 236 that signed up to attend in person. There were 97 people asking to join us via Zoom, live streaming, and we had 21 vendors who were there that represented the state of Mississippi, so that churches could communicate and also see what resources were available for them to have at their fingertips when they are dealing with conference sessions of individuals who may have some mental health issues. What we found is that people were glad to be in an atmosphere where they could really share what they were feeling. And we continued that conversation with our keynote speaker on Friday. And the result of it was that many of the pastors said that they need something separate from the general group, because some of them are dealing with some mental health issues on a personal level that they would like to be able to share in a more intimate setting. So that is something that we are considering as we enter into our closing of the pilot project and hopefully expanding CROP to a greater degree across the state of Mississippi, for us to really just have a session where we can hone in for the pastors to have an atmosphere of safety so that they can learn more about how to deal with some more personal and relevant issues. We have to date made 114 referrals utilizing CROP. We still see hesitancy from some people trusting many of the identified people to work with them. But we do have a number of referrals that have been made. You can see here that we have a cross-section of ethnic groups. We had speakers that talked about mental health in the American Indian population. We deal with the Caucasians. And even though this project started in the African American community, as been stated earlier, mental health has no barriers, no racial lines, no socioeconomic level. Mental health covers all ethnicities, all socioeconomic levels. And so across the state of Mississippi, we are wanting to spread the information and get the word out that it is okay to receive help. And we do it through various avenues. Some churches do feeding programs once a month. We hand out literature. We were able to, through our first faith-based summit, we were able to do marketing with the media, the Mississippi Christian Magazine, Mississippi Today, Fox News, and WLBT, and iHeart radio stations. So we were able to get the word out across the entire state. As a result, we had one person to contact us out of the state of Texas who were needing help in Fort Worth, trying to get help for one of their loved ones who was experiencing a mental health breakdown. So the Congregational Recovery Outreach Program, CROP, as we like to call it, is one of the moving pieces in the state of Mississippi to help us get the word out that it is safe and it is okay to receive help. I appreciate you all allowing us to speak and share what we're doing. We provide spiritual and pastoral support. We involve our community, and we are looking for others to put their hands to the plow. You can reach us at www.msphiprop.org. You can call us at area code 601-398-4406. And we will be happy to share with you exactly what we're doing and what we're doing to improve our efforts. Training is our key, educating and making people aware of what's out there and what they can be doing in their individual spaces in order to spread the word to reduce the stigma and the negativity associated with seeking help for mental illness and for substance use disorder. Thank you so much for having us. And if you have any questions, we entertain them.
Awesome. Well, thank you, Katie and Sylvia. We've got some great feedback for you in the chat. I hope you all are feeling the love, some good questions. Before we go to those questions in the chat, let me bring up our roundtable. We have today joining us on the roundtable Dr. Brian Sims, who is a senior medical advisor for NASHPD, the National Association of State Mental Health Program Directors. Brian, can you give us your feedback?
Wow. I think I would start off with wow. I am just incredibly impressed with this program. I want to give thanks and a big shout out to Katie and Sylvia, but I also want to give a big shout out to Wendy because
Amen.
I can say that I've also visited Mississippi and watched as that commissioner there and the love and the camaraderie and the collaboration that existed from within the group really gives you an overall premise as to why they are doing the wonderful things that you're seeing happening there in Mississippi. I I have to admit, I'm at that age now where I probably have been in a lot of places, and one of the places I've had the fortunate element of being in was in that 2005 conference that was mentioned earlier in Memphis. It was at that point that many of the faith-based leaders had expressed a desire to learn more and be able to share with the groups, because as we're looking at this as Mental Health Awareness Month, I can't imagine a more fitting topic to be able to speak to, because in our role through NASHBIT, we speak to the states, and many are admitting still at this juncture, almost 2 years into its implementation, there are many communities and many individuals that are still either unaware of what 988 is, or if they are aware, they're misinformed with regards to the services that are committed. So when you start to look at these wonderful programs, just like Mississippi is offering, it gives the opportunity to empower the communities. And that's what I see in this program. And really what I love about it is the genuineness. And they had mentioned a little earlier about using trauma-informed perspectives. Sometimes we don't have to get more complicated. We need to stay more on the simple side. And the simple side says, treat others as you would like to be treated. But when you're trying to engage with communities, understand, appreciate that there is a degree of cultural history involved in those communities. And that to appreciate those histories means that you also need to understand those barriers that might exist. Because sometimes we think as a community that all we have to do as leaders is offer the services and people will just come to it. But for many reasons, we know that's not the case. So I'm really pleased to see how much this particular crop program has gone into the community, has not only connected and collaborated, but also empowered, using the trauma-informed elements that we're all pretty much aware of. You know, we know that, for instance, everyone, regardless of who they are, and regardless of the circumstances that they're going through, they have a story. And I had a pastor of mine from a number of years ago, and she's passed on now, but she had said, when you see a person, understand that that person is saying to you, I don't look like what I've been through. So as we begin to investigate it, this is the perfect opportunity with the crop program and its interjection into really going into the community and respecting that community's history and being able to be culturally sensitive. And most of all, express cultural humility. All of those pieces are valuable points that drive this whole system to becoming a wonderful outcome as they are seeing right now. Because we look at our own communities and we have to ask the question, first of all, from the leadership that is going in on this collaborative effort, and that is there the buy-in? Do they understand the humility? Do they understand the sensitivity? So in this element, we see where through the efforts of the commissioner and as well these wonderful folks, I remember going there and they had a booklet that they had prepared for that session. And in the back of the book were pictures and names of staff persons from all over the various jurisdictions where they were just raising them up for different reasons. These are the things that people want. They want connection. They want to be able to be a part of services. And most of all, when that happens, you see trust very quickly get established, either through the faith-based leaders or designated individuals and the community, or the community begins to then see that because there was humility expressed, because there was respect of the culture, they then can also express their trust in others. So I'll turn it back to you, Laura, at this point. Thank you. And I really want to thank Laura. I thank Katie and thank Sylvia, and again, thank Wendy.
Thank you, Dr. Sims. That was just phenomenal. Too many good nuggets for me to pull out. But yes, you don't always look like what you've been through, and sometimes that's a good thing. But just so important that we are outreaching people where they are. So thank you, Dr. Sims, for your feedback. We've got some questions here in the chat that I want to make sure that we uplift. So Katie or Sylvia, you know, whoever wants to take the first crack at this question that we have from Jaslyn. Do you all have any insight into how this program uniquely impacted youth, or advice on how to best reach out to youth who may or may not be in that church community anymore? So I'd love to hear your perspective.
Okay, I think I responded to some of it in the chat, but I don't mind sharing. What we found is in the churches that we are partnering with, they have youth groups. One of our youth groups do a podcast with the youth, and they have what they call rap sessions. And in another one, they have a youth pastor that gets them involved with real life topics and see what's on the youth's mind. The universal message that we get from most of them is that the youth want adults to listen. We also know that as a result of COVID and the isolation, we see a lot of behavioral methods where the youth didn't deal very well with being isolated. They're social beings. And so what the partnering churches that we deal with are having done is during the summers, they try to do events that involve the youth, bring them out and let them do creative ways, performance. So they perform, it's like a theater, if you will. And we've had them inviting each other's churches and opening it up in the city of Jackson to many of the individuals. In fact, our city government is also sponsoring a theater challenge for many of the youth that are not necessarily associated with the church, but they are bringing them together so that they can share their thoughts. And we can have those providers present there so that they can get their questions and also some of their concerns out in the open and addressed.
Yes, thank you for putting that in the chat and expanding on that, Sylvia. This is just so important. So just thank you and Katie for your work on this. And I have not had the pleasure of seeing this, but now I want to add this to the list of things that I want to make sure that we are talking about and that I'm more familiar with. So just thank you both for your work. And of course, I encourage anyone, if you have additional questions, please put them in the chat. Or I think there was a QR code in that presentation. So make sure that you reach out if you have questions, comments, thoughts. Just really appreciate you both for joining us today and being our featured presentation. So it's going to be a tough act to follow, but I'm going to ask us to move forward. And we have Dr. John Palmieri here from SAMHSA. So Dr. Palmieri, please give us some SAMHSA updates.
Hey, Laura. Yeah, that's an impossible act to follow. That was a really interesting, amazing, inspirational conversation. So many of you know that we in the 988 office with a number of other partners and centers and offices across SAMHSA and federal partners recently held a pretty large convening in Chicago that ran over the course of, there's a nice picture of it there, 2.5 days. For all of our 988 tribal, state, territory grantees, the 988 Lifeline Crisis Centers. Obviously, Vibrant was there as the Lifeline Administrator, and then a number of other state leadership partners, provider partners across the crisis space. You can see there a picture of the Secretary of HHS. Secretary Becerra was there to provide some remarks as well. Just really demonstrating the tremendous engagement and support and buy-in that the administration has had in 988 implementation and in the broader transformation of crisis services. I think in general, people found the convening extremely energizing, stimulating, obviously lots of things to lift up in terms of work that's happening across the country, certainly at the federal level, but then I particularly enjoyed the breakout sessions where we got to learn from our partners at the state, tribal, local provider levels who are doing like amazing work every single day on the ground and providing care for people in very innovative ways. And so learning from them, lifting up some of that work was really exciting for me personally And then also the ability to kind of weave in stories throughout the 2.5-day convening to really get a sense of kind of the personal impact that these services have and that crisis counselors have on people when they need help the most. And so that was incredibly uplifting and affirmative. There was a movie screening of the work of a crisis counselor, just tremendous opportunities for conversation and engagement. And, you know, obviously points of friction at times, because we are still all working to grow the system together, and that naturally creates growing pains and challenges in terms of role clarity and who's doing what. But I think that all of that is in the interest of the greater good, honestly, in the way that we serve people moving forward. So I just wanted to reflect for a minute on that tremendous meeting. We are already discussing opportunities to replicate that in some way in the future, although more to come on that. I also did want to mention, because it did come up at the meeting, and I did just kind of reference it briefly just now with respect to kind of SAMHSA's role and the role of the Lifeline Administrator in supporting kind of core requirements across the network. And I think we might have talked about the quality and services plan that SAMHSA put out last month, but I will also throw it in the chat, the link. This is a public-facing document, which we were directed by Congress to produce, which really kind of sets sort of a floor of core expectations for the performance of the Lifeline network, understanding that states, localities, tribes are going to build upon those core expectations in a number of ways, and wanting to make sure that we want to maintain the integrity of the system, the user experience, or the experience for the help seeker with kind of basic quality assurances, and at the same time understand that you know, states and localities have their own mandates to build upon that, to in some cases make the requirements more stringent or to add on to them. And we want to make sure that the plan both sets kind of a floor of expectations and provides flexibility for localities to build upon their network as it's integrated into their broader crisis system. So the plan kind of goes through a lot of that language and sort of basic expectations, and again, ways to promote the flexibilities in partnership with states and territories and tribes around the development of those systems. So I'll put the link in there in the chat for people to take a look at that. And then the other thing that I wanted to mention, Laura, just briefly, which I'm guessing has come up in previous meetings, I just wasn't at the last one, is the notice of proposed rulemaking for the FCC. The public comment process there on geo-routing is still open. And so I also will put in the link opportunities for people to provide comment or feedback on the proposed rulemaking related to geo-routing, which as you know, Laura, and I know many other people know, has been a priority to improve the routing structure of the network to get people closer to local supports. And so this is a mechanism to do that while maintaining and respecting the privacy concerns that people have when they're contacting the Lifeline. So I think that's it for me, Laura, and I will hand it back to you.
Thanks, John. I just want to take a moment here to really thank SAMHSA, HHS for your leadership in this convening. It was just such a great opportunity to bring together all of the crisis contact centers, or the majority of them, who are in the 988 Lifeline network, to bring together state partners, tribal partners, allied organizations. You know, it was a really great event, as you said, to just hear feedback, both good and ways that we can improve, because we want to ensure that the health of the network is strong, so that we're ultimately serving that individual who may be in crisis well. So I just want to thank you, John, and the 988 team, my colleagues at Vibrant who worked very hard to pull this together, colleagues at NASHBID and other organizations who were there. If you weren't there, it was just a really phenomenal event. I want to thank our crisis centers for showing up. And again, Vibrant having the ability to sponsor some of those folks to attend. It was just really great learning, hearing about what each state is doing, hearing the feedback on any number of items, including that network agreement that you just mentioned. So I know there's been a lot of work coming out of the SAMHSA office with the quality assurance saving lives plan, from HHS with the national strategy for suicide prevention that we've talked about before in the JAM. So I just want to say thank you to our incredible federal partners.
Thanks, Laura.
Yeah. Okay. Well, with that, let's go to another incredible partner, Dr. Brian Hepburn with NASHPD, the National Association of State Mental Health Program Directors.
Thank you, Laura. And I want to echo what you and John said, that the 988 grantee convening in Chicago was really special. Want to thank SAMHSA and Vibrant for the convening and for their continued leadership. I would say it was almost like a group hug, right? The full time that people were there. And there were important issues that were brought up that are going to have to be worked out. But overall, it was just a super meeting, and an opportunity for the different groups to talk about the successes, the challenges, and most of all, to talk about the collective goal of the success of 988. Wanted to thank the Assistant Secretary, Miriam Delphin-Rittman, and the 988 team, Monica Johnson, John Palmieri, the rest of the team, and the CMHS people. It was just really good. So, and Laura, please thank Tia Dole for her attendance and for her contribution. She's always so supportive of the effort. In addition, I wanted to go back to talk about the Congregational Recovery Outreach Program. That was a really nice presentation. And we heard Wendy talk about it on one of our one-to-one state calls. And so I would echo what Dr. Sims said, that it's so inspirational to hear about what Mississippi is doing to reach out to marginalized populations, to try and make sure there's an inclusiveness to all groups. And I thought Sylvia Turner did a great job of summarizing the program. And also she referenced the Tennessee recovery model. And it's a good example of how we're not really out there to do things that other states haven't done. We're out there to look at what are other states doing that we might be able to bring to our states and to have them benefit. So I think this is a really nice example of, as Dr. Sims often says, that those things that we can copy from other states, he usually says things that we can steal from other states, but I'll change it to copy. So that we can really benefit across the country. That video was fantastic. We're hoping to be able to use that elsewhere. And I want to say that the words that Wendy Bailey talked about, hope, healing, access to help, love, support, caring, that's what it's all about. How do we basically make sure that 988 and crisis services are available all across the country to help people with mental health issues, substance use issues, and to do a better job. So thank you, and back to you, Laura.
Thank you so much, Brian. And again, your leadership in this space, amplifying the role of states, very important as we think about implementation across the three pillars. So thank you and your team, who are always just so wonderful. So with that, let me ask our colleagues at NAMI, Stephanie Pasternak, and my Vibrant colleague, Shelly Polanco, to come forward and give us an update on what else the states are doing when it comes to 988 legislation.
Happy to. Thanks so much, Laura. So we're going to touch on a couple states today. I'm going to start up in Maine. So a few weeks ago, Governor Mills signed Maine's supplemental budget into law, and there is some good news for mobile crisis teams and also crisis stabilization efforts in that final package. A few things to note: it adds a definition for crisis receiving centers into state law. It provides funding for two new crisis receiving centers in the state that will get started in 2025. Just for reference, the original ask had been 6, but as kind of the overall costs of the package was negotiated, that was lowered to 2. There's also a big focus on incorporating peer support specialists into mobile crisis teams. And the bill provides over $2 million to aid with that effort. I will say some of this funding is really one time for now, but now that these line items have been incorporated into the budget, hopefully that will increase the chances that we see this become a recurring line item in Maine. And with that, I will turn things over to Shelley to talk about New York.
Thank you, Stephanie. So as session has been closing for some states, they're kind of starting to sign, the governors are starting to sign off on a couple things. So for New York, Senate Bill 8303, it has aids for localities in their budget. So this was enacted on last week, May 1st, and it allocates $60 million for repayment costs related to administration, design, installation, construction operations to and for maintenance for 988 and behavioral health crisis hotline systems serving the state. It also provides $10 million for youth suicide prevention services, $1 million for suicide prevention efforts for veterans, first responders, law enforcement, and correctional officers, and as well as $1 million for suicide prevention for high-risk populations, including Latino youth, lesbian, transgender, queer community, and rural communities as well. There is also a bill, student ID bill. So they're having a hearing. One of them has a hearing May 22nd, and the other one had a hearing yesterday. It requires colleges and universities to conduct educational campaigns targeting students, faculty and staff for awareness around 988. The campaign is also required to include resources detailing any crisis services in the area, and then also specifies contact information for these services that must be printed out on student IDs. And that's it for me.
Awesome. Thank you both for that update. Okay, well then we are going to move forward, and I'm going to ask Stephanie Hepburn, who's the editor of the Crisis Talk articles, which are always phenomenal, to talk about her latest article.
Thanks, Laura. Yeah, so today's article is actually from The Vault, and it features an interview I did with Dr. Sidney Hankerson. He's a researcher at Mount Sinai System in New York. And he shared how pastors are frontline mental health professionals, much like today's presentation, regardless of race or religious affiliation. However, in his experience, he told me the same can't yet be said for substance use challenges. And he said, unfortunately, in many faith communities, there's a higher level of stigma around substance use than depression or anxiety. It's often viewed as a character flaw, a personal weakness. And so that sparked him to co-develop a study of naloxone delivery through a network of faith-based organizations in New York City, where drug overdose mortality is highest among Black and Hispanic populations. But I think it would be great if he spoke, he maybe already has, but with the CROP team, Laura, I think they're like has been mentioned previously, I think there are a lot of lessons learned that programs and states can learn from one another.
Yeah, and I think that's such a good point, Stephanie. And if you all don't mind, indulge me in this for just a little bit, maybe I can bring Sylvia back into the conversation, and would love to hear, Sylvia, you just reacting. I don't know if you've had time to read this article, but what are your thoughts as you hear Stephanie talk about her conversation with Dr. Hankerson? Do you have any reactions to that?
Oh, I'm sitting here on pins and needles because I agree. In the African-American community, we are passive in admitting many of our disparities, or having to need assistance or wanting assistance. And so, yes, I agree with him. Mental health, people can gravitate to seeking help much more easily than if they have substance abuse. That's just something that we need to continue to work in the area of helping them understand that it's a disease and that it is treatable. And we need to continue to show what Wendy says, hope, love, compassion. And the only way that we can do that is we have to get out in the community. We have to be visible. We can't just talk the talk. We must walk the walk as we talk the talk. And that's what we're finding. That's why with the churches that we're engaged in, they have elected to use every avenue of outreach that they do to promote the message against stigma and against negativity. So we put flyers in their packages for food monthly. We go to daycare centers or in their daycare centers in schools to talk about the need to have open conversations about depression, about not feeling well, mentally or physically. And yes, I agree wholeheartedly with Dr. Sydney Hankerson in his assessment.
Yeah, thank you for that. Because I think for me, what's striking me here, right, is that we also need to think about policy shifts, right, and system shifts, because reading the quote that it's viewed as a character flaw, a personal weakness, when there are, what can we be doing as a society to wrap our arms around folks, to let them know it is okay to ask for help, whether it be a spiritual leader, a pastor, or someone else. And I think, again, just as you all highlighted in the feature presentation, that's, the work in the community is really where the rubber hits the road, and making those shifts to let people know it's okay. So thank you both. And thank you, Stephanie, for bringing this one from the vault. This is, I think, very timely.
Thanks, Laura.
Okay, so with that, and thank you all for indulging me there, I'm going to see if Vic Armstrong is here for our Strong Talk, which is his podcast. And Vic, of course, is the VP for Health Equity and Engagement at the American Foundation for Suicide Prevention. Vic, are you with us? Okay. Vic may not be with us just yet. So in lieu of that, I'm going to ask for folks, if you all have, and again, recognize that we have highlighted the work of Sylvia and her program and Katie's program. But if anyone else has experience in working in this space, would you want to raise your hand, come on camera, come off mute, and share what your experience has been? And it looks like Vic may be having some issues joining. So when he does join us, we will pivot to him. But if folks have any experience they want to share, let me see here.
I do.
Yes, please go ahead, Stephanie.
Thanks. I was sending a note in the chat, but this might be a little bit easier. I just wanted to say, I live in Ohio. I am and have been writing about living with major depression and suicidal ideation for about 11 years now. And okay, sorry. Let's see. Oh, okay. I'm on my phone, so I don't know if I can.
We can see you and hear you just fine.
Okay, that's fine. But I've been, as I said, I've been writing about living with a mental illness, depression, and what I call generous episodes of suicidal ideation for about 11 years now. And my goal is to respectfully disrupt the stigma associated with mental illness within 3 communities: Black community, the legal community, and the faith community. And at NAMI Franklin County, I worked there as the assistant director. We recently did and held a faith link summit for faith leaders around Columbus. But the one thing that I will just say personally is that I have made the commitment to tell my story wherever I have an opportunity to do so, and because it is incredibly important that we talk about this very candidly, especially in the Black church, because it is there from what I call the pulpit to the parking lot, and yet it is still such a tough barrier to overcome. So, and I'm very excited about the CROPS work and to learn about it. And so if you ever need some assistance, please do not hesitate to reach out. Thank you.
Thank you for sharing that, Stephanie. It's just so important that we, again, continue to tell our stories and destigmatize this work and experiences that we may be having either personally or any lived experience we may be having. So thank you for sharing that. I'm also just checking out the chat here, and it looks like we had a question from Monica around 911 and 988 call transfer processes. So I see there's some responses here. And again, some folks are highlighting that 911 is very local. Is there anything that, John, you want to add from SAMHSA's perspective? I don't know if we had that collated somewhere.
I mean, I would say that this is, obviously an area of priority for us. And so, we have, as many of you know, have been conducting a webinar series on 988 911 coordination and using that as an opportunity to lift up successful local practices that have developed protocols, triage protocols, et cetera, co-location protocols to support that coordination. We are also hoping that that will lead to a publication or guidance document that SAMHSA will be involved in releasing, hopefully over the coming several months, as well, to support ongoing learning in this space. And there is, related to that, some work happening on the development of kind of a liability toolkit, understanding that one of the barriers for the coordination and for the 911 partners to have reassurances or comfort that those calls can be handled by the 988 system is addressing issues or concerns that they have around liability and risk when they hand those contacts off. And so there is also work happening in that space to develop a toolkit around that particular topic.
Awesome. Thank you, John. And I know Tiffany in your office handles a lot of this work. So again, just thank you all for what you guys are doing, to help all of us when it comes to implementation. So with that, guys, let's see what's coming up next on the horizon. Next week, we have frequent callers to helplines, or as we call them at Vibrant, familiar voices, folks who may need to call helplines. And we have Dr. Brian Mishara, who will be joining us. And then the week after that, so in 2 weeks, we will be hearing around tobacco use, mental health, and substance abuse. Again, all those things can coexist. Just want to thank you all for joining us for this past hour. Hopefully you have learned something. Again, if you want to participate in the hot seat, or if you have an idea for a future presentation, please reach out, let us know. Otherwise, we'll see you next Wednesday. Thank you so much. Have a great day.